Nursing by Erica Meadows. The art and science of nursing requires critical thinking skills, patient-focused care, and a passion for helping others. Nursing requires someone who has both knowledge-based skills and critical thinking skills. A nurse must be able to apply the knowledge she has learned to fit the situation her patient is in. This is why nursing is considered an art and a science. Nursing also takes great compassion and someone who is able to separate their personal beliefs to care for someone with no judgment. Registered nurses provide and coordinate patient care, educate patients and the public about various health conditions, and provide advice and emotional support to patients and their family members. RNs must have a large amount of specialized knowledge to assess, plan, and intervene to better promote good health and to prevent disease in patients. When they are providing direct patient care, nurses often observe, assess, and record vital health information. This provides other healthcare professionals with a basis for care planning and intervention. Nursing, education, and training. There are many different types of nursing that require different credentials. The most basic level of nursing is a registered nurse, known as an RN. You can receive your RN license with an associate's degree in nursing or with a bachelor's degree in nursing. Your associate degree will take 2 to 3 years to obtain, whereas a bachelor's degree takes 4 years. The difference between those degrees is that with a bachelor degree, one would be able to work as a charge nurse or in a managerial position, or work in research or teaching. In all nursing programs, you will need to take tough courses in physiology, anatomy, microbiology, nutrition, psychology, and chemistry. A bachelor's degree program also will have education in physical and social sciences, leadership, communication, and critical thinking. You can also work for a time with an associate's degree in nursing and eventually earn your bachelor's degree. This flexibility in entry into the profession is one of the biggest advantages of nursing. The highest you can go would be to receive your Master's of Science in Nursing, which requires a bachelor's degree and then 2 more years of schooling. With your MSN, you would be able to be a nurse specialist, midwife, or a nurse practitioner. Even after you get either degree, you still must take and pass your NCLEX exam, which will license you. Job outlook and income. Employment of registered nurses is projected to grow 19% from 2012 to 2022, faster than the average for all occupations. Growth will occur for a number of reasons, including an increased emphasis on preventative care, growing rates of chronic conditions such as diabetes and obesity, and demand for healthcare services from the baby boomer population as they live longer and more active lives. Also, there is more financial pressure on hospitals to turn out patients as soon as they can. This will increase the numbers of people who are sent to long-term care facilities and outpatient care centers. So it is logical that there will be a strong job growth for nurses in those organizations. The average national salary of jobs for this career was $64,000 with a high confidence ranking based on over 250 sources. Average registered nurses' salaries for job postings nationwide are 7% higher than average salaries for all job postings nationwide. The top 10% in the field earn over $94,000. Generally, these professionals have many years of experience and usually have their master's degree in nursing. Workers who are employed for the government generally receive the highest salaries, followed by nurses at various types of hospitals. The lowest paid RNs work in doctors' offices. Pros and cons of nursing. Becoming a nurse has many rewards. You will make a difference in many people's lives on a daily basis. How many people can say they know they've made a difference in someone's life, let alone multiple people's? Helping others makes nursing extremely fulfilling. Another pro is that no one will be like the next. You will always be introduced to interesting and thought-provoking patients with unique stories. You will learn a lot just from your patients. This can keep the job exciting. Also, with nursing, your hours may be flexible. You might work 3 days or nights and then are off 4 days or nights. There is also always the choice to pick up extra shifts if needed. Another advantage to nursing is the wide range of fields you can get into. If you get your degree in nursing and start out working for a pediatrician, but then realize this is not right for you, you have the option to switch to another field that may be more suitable for you. One of the cons of nursing is the exposure to germs and viruses. While you build up your immune system to certain bacteria, depending on the field you work in, you may be exposed to potentially life-threatening viruses or germs. Another con is that nursing can be overwhelming. Many nurses have a lot of patients depending on them day in and day out. This can be overwhelming for some people, especially if you are having to deal with an unhappy patient who does not treat you well. Nurses are dealing with sick people, and when people are sick, they can be cranky. So the nurse has to be kind of the patient's punching bag to a certain extent. Nurses also see a lot of tragedy on a daily basis, and this can wear on someone if they're not mentally strong enough to be in this kind of field. Required skills and knowledge. Each nurse can be given many patients to look after at a time, so it is better if the nurse remains prepared for shouldering all the responsibilities. It will be beneficial when filling medical charts and allocating medications. In this way, the burden for the nurses will reduce in case of emergencies or any crisis. Nurses will also be working in fast-paced environments that can be life or death that is very stressful. They will need to have coping mechanisms to handle the stress that will come their way. Kindness and compassion are the major essence of the character of a registered nurse. An efficient nurse has to be considerate, sympathetic, non-judgmental, and should have the ability to provide comfort to both the patient mentally and emotionally. Nurses must also have excellent communicational skills, as they will be the one who the patient may need to lean on in hard times. They are responsible for comforting their patient and making them feel respected and that their feelings are heard. Dealing with ill patients requires a lot of patience and dedication to their care. A nurse must be very detail-oriented since there is another person's life in their hands. They must be diligent about not making mistakes and reducing medication errors by being alert and observant. Every RN must have the skills to analyze, review, and judge different situations in the medical field. It may be an emergency or a sudden casualty. They have to take accurate and suitable actions considering the incident. They can't get annoyed and lose temper because it can result into fatal situations. Every day in this field is different, and so are the judgments and decisions. Related occupations: cardiovascular technologists and technicians, diagnostic medical sonographers, dietitians and nutritionalists, emergency medical technicians, also known as EMTs, and paramedics, licensed practical nurses, also known as LPNs, nursing aides, medical and health service managers.